Hello friends, welcome to DentTuber. Friends, today we are going to discuss some important MCQs of oral pathology, and the topic for today is pulp and periapical infections. So first question is, all of the following statements about the typical feature of a periapical granuloma are true except it consists of a proliferating granulation tissue. It can form only if the periapical bone is resorbed. It shows evidence of local antibody production. It results from immunologically mediated tissue damage. So the correct answer is that it shows evidence of local antibody production. So this is not the typical feature of the periapical granuloma, while other three are the features of a periapical granuloma. So let us move on to next question. Phlegm is a sexually transmitted disease, type of a cellulitis, type of osteomyelitis, endocrine disease. So the correct answer is it is a type of cellulitis. Let us move on to the third question, friends. Most common cyst in the oral region is medial cyst, radicular cyst, follicular cyst, nasolabial cyst. The correct answer is a radicular cyst is the most common cyst in the oral region. Next question. Dental cyst occurs from a reduced enamel epithelium, replaces the tooth to which it is attached, is frequently seen with a missing tooth on the X-ray, cystic lining of stratified squamous epithelium. The correct answer is, friends, cystic lining of the stratified squamous epithelium. The earliest response of pulpitis is cyst formation, calcification, hyalinization, formation of dental granuloma. The correct answer, option which is the answer is the earliest response of pulpitis is hyalinization. Next question. GARS chronic non-suppurative sclerosing osteomyelitis is characterized clinically by endosteal bone formation, periosteal bone formation, resorption of medullary bone, resorption of cortical bone. So the correct answer is, friends, periosteal bone formation. That is, GARS clinical non-suppurative sclerosing osteomyelitis is characterized clinically by a periosteal bone formation. Apart from GARS osteomyelitis, periosteal bone formation is seen in Caffey's disease or infantile cortical hyperostosis. Other disease in which periosteal new bone formation is seen is hypervitaminosis A, syphilis, leukemia, Ewing's sarcoma are some of the conditions in which periosteal bone formation is seen. Next question. Abscess formation is particularly a characteristic of infections with which of the following microorganisms? Viruses, Rickettsia, Streptococci, Staphylococci. So the correct answer is option is Staphylococci. So let us move on to next question. Organism involved in cellulitis is Streptococcus mutans, Streptococcus pyogenes, pneumococci, and Klebsiella. The answer is Streptococcus pyogenes. Let us move on to next question. An acute apical abscess is usually a result of periodontal pocket, occlusal interference, necrotic pulp, chronic gingivitis. The correct answer is necrotic pulp. And abscess may develop directly from a necrotic pulp, or more commonly it may originate in an area of chronic infection like periapical granuloma. Next question. Which of the following conditions is associated with a vital pulp? Apical cyst, apical scar, condensing osteitis, chronic apical periodontitis. The correct answer is, friends, condensing osteitis. The next question is, main causative agent of Ludwig's angina is anaerobic streptococci, aerobic streptococci, staphylococci, legionella infection. The correct answer is, friends, aerobic streptococci. So Ludwig angina is basically a severe form of cellulitis, and it usually begins in the submaxillary space, and it secondarily involves the sublingual and submental spaces. And second and third mandibular molars are the chief source of infection. And mostly the cases of Ludwig's angina are mixed infections. However, streptococci is invariably present in Ludwig angina. So if second and third molars are involved, which are mostly involved, then submaxillary space is first involved, as the apices of second and third molars lie below mylohyoid ridge. And if second premolar and first molars are involved, sublingual space is first involved, as their apices lie above the mylohyoid ridge. So these are few important points related to Ludwig angina. Let us move on to next question. The most common organism involved in a periapical abscess is Streptococcus pyogenes, Streptococcus viridans, beta hemolytic streptococci, non-hemolytic streptococci. Answer is Streptococcus pyogenes. Next question. The earliest radiographic sign of osteomyelitis is a solitary or multiple radiolucent areas, increased granular radiopacity, blurring of trabecular outlines, formation of sequestrum appearing as radiopaque patches. The answer is blurring of trabecular outlines. So in acute osteomyelitis, little or no radiographic features are seen for at least 1 or 2 weeks. At a later stage, diffuse lytic changes in the bone begin to appear. Individual trabeculae becomes fuzzy and indistinct, and radiolucent areas begin to appear. And in earlier stage of chronic osteomyelitis, mottled appearance is seen in radiographs. And in established cases, moth-eaten appearance is seen because of the enlargement of medullary spaces and widening of the Walkman canal. Let us move on to the next question. Osteomyelitis begins as an inflammation of cortical bone, periosteum, medullary bone, periosteum, and inner cortex. And the answer is medullary bone. Next question. Focal sclerosing osteomyelitis is due to an excessive periosteal bone formation, an extremely painful condition due to low-grade chronic infection, a common sequel following sequestrectomy. Answer is focal sclerosing osteomyelitis is due to a low-grade chronic infection. So this is all about today's video, friends. Hope you enjoyed the video, and if you like the video, please hit the like button, subscribe to my channel if you have not already subscribed to it, and also share the video with your friends so that they can also take benefits. And if any feedback or suggestion you have, just give your suggestions and feedbacks in the comment section. Thank you so much, friends.